who's sitting next to me. And I'm also pulling it out from a study I've just concluded on determinants of utilization of youth-friendly sexual and reproductive health services in KCCA health facilities. I've done that study and I've just concluded that study. It is challenging if we could give a place like Kawempe, where a colleague has mentioned it very well, that where we have friendly services is Komamboga. And I agree with him. Think of a young person who wants to get a service. She doesn't know, or he doesn't know what he's going to eat as lunch or supper, but want that person to live where he said to get a service in Komamboga. Live Kalere, get a service in Komamboga. The cost alone of accessing that service is beyond his or her control. That was one of the findings. 2, attitudes of these health workers. I can give you an example. I went to one of the facilities I'm not going to mention. Midwife came very late, around 10 a.m. with her kids and like a small bag, the way they walk. So before she even entered the office, she looked at the ladies who had come for ANC. Then there was a young girl, 15 to 16. Then started, even before he even said good morning to those people who were there. You, at this age, yes, she was telling the young girl, you, at this age, do you see anyone of your size in this? How dare you are seated in these mothers? Don't you think you don't fit here? Before she even listened to her. Then, the attitude of health workers is also another contributing factor. And that was not the issue. But I want to show you what is happening outside there. So as we are looking at stigma, there are so many promoters of stigma to these young people. So many promoters of stigma to these young people. As we are looking at the values, the norms of society promoting, but there are also other promoters. Think of their partners. They come to them, you know, even if, before they even mention the word pregnant, they are chased away. You pregnant? Me on a Friday? We don't make pregnant. You know, those challenges, you have them in young people. So if you look at those challenges, that is stigma number 1 from the pattern. How can we convince the partners to know that if they have made someone pregnant, it is their responsibility? Because it's stigma. When I come to you and you say, it is not my responsibility, I'm not the one, yet I know you're the one I've been moving out with. So that alone, it is stigma. So to me, the only way we can fight stigma is to carry out regular community sensitization. He has talked about it, that they have a team of VHTs, they have, he has mentioned Sheikha Mwanje, but that one alone in quotes, Sheikha Mwanje, is he friendly to the young people? Is he the person who can approach the young people? Where are the peer educators who are educated and have got knowledge and they can reach out to the fellow young ones? So I think what we need to do is to have different cadres doing different roles in the community, and we need to promote community sensitization. So as we create awareness, we can reduce stigma in the community. At the same time, not reducing stigma, but when someone is aware of the repercussion or the dangers of what they are doing, definitely also do what? To also reduce. That's what I can say.